Let's go into the Zoom now and speak to some people at the back of this. Hannah Awadzi is Executive Director for the Special Mothers Project. Good morning, Hannah.
Good morning.
Thanks for joining us. We also have Dr. Hilda Boy, who is a pediatrician at the Kolebu Teaching Hospital. Good morning, Doc.
Morning.
Let me start with you, Hannah. What's your reaction to this very emotional story you watched there?
Okay. Yes, it's very emotional, but Martin's case is just one of the stories that have come up on the media. I meet with thousands of families in Accra and beyond that have this condition, that have this situation that they are dealing with at home, and nobody seems to care. There are no policies. So it's just people dealing with it in their own corner. We are lucky when we get cases out like this, so that at least it gets to people's attention and government gets to know that this is happening.
Okay. But how's the state? You said we hope that government gets to hear and know that something must be done. But how's the state helping in terms of welfare for kids such as this?
Okay, so in Ghana now, with my last checks, there is no concrete policy for children with cerebral palsy in Ghana. We do policies without them. We are leaving them behind. Now there's an attempt. So they are trying to review the early childhood care and development policy, which now centers on the child with disabilities. We have the inclusive education policy, which exists on paper but doesn't work. So in terms of what is there, what the state is doing for children with cerebral palsy and by extension other disabilities, nothing exists. It is you, the family, and your God.
Interesting. But can you help us with some more experiences? You mentioned that there are some more people you do encounter every now and then. What are these experiences?
Their experiences are similar to what we saw with Martin. So I get to meet them because I have a support group called the Special Mothers Project, which was started about 7 years ago when I had a daughter who is now 9 years with cerebral palsy. I faced the same challenges that Martin faced. I couldn't work. I was backed down with the child. And I realized the support system, the lack of support system is a big thing that we don't even have conversations about. In Ghana, we have conversations about everything, but about the family unit and about our children, those important conversations seems to be on the back burner. So this is how I get to meet families. Because I have a support group, I am very loud on Facebook and others. Parents come to me. We have an online WhatsApp platform with a lot of parents who share some of these experiences, similar to what Martin is experiencing. And you don't know where to turn to as a parent.
Good to hear that because while I was watching this, I was asking myself, so where can Martin really get the support to help? Because he really painted a picture that things are very difficult, and we saw it in the narration there. How can someone living far off like that get access to, your support?
So Martin, I know Martin. I call him Madam. Martin is a member of the Special Mothers Project. He's been on our platform for over 2 years.
Okay.
We've done a few things to support him, and we also have pushed him a bit in the media space to get people to know his story. So he's a member of the Special Mothers Project. It has members all over Ghana, from the North, Ashanti region, Eastern region, wherever, where we meet on WhatsApp most of the time and share our frustrations, but also encourage ourselves and see how we can together advocate for the government to hear our cry.
Hannah, hold for me. Let me bring in Dr. Hilda Boy now. I'll come back to you. Doc, so you are in the medical profession. I'm sure you do encounter some of these things. How widespread is it? Although we know there are no statistics, but you are in the field. I'm sure you know how regular or unregular it is. So help us understand how regular this is.
Okay, I think you already gave a few statistics when you did the presentation at the beginning. But additionally, I'd say that every week in the hospital now, we see children who are coming for review with cerebral palsy. And at the clinic, at the neuro clinic where I work on Mondays in the hospital, every week we do have children who are coming in as first time diagnosed with cerebral palsy. So it is something that we see, unfortunately, often in the hospital.
Wow. We don't know what causes it, but are there conditions that probably could lead one to getting the child having this condition?
Yes, so there are. So some of them are things that we cannot actually pinpoint and say that, okay, this is exactly what caused it. But there are some children who are born with it, as in they have certain things in the brain that has caused them to develop a cerebral palsy. We also have some children who will have what we call hypoxic ischemic encephalopathy, or asphyxia in simple terms. That is, during the process of the delivery, they did not get enough oxygen right after birth. And so as a result of that, the brain suffers some damage, and as they grow, they will develop the cerebral palsy. And that is also a group that we can easily prevent. Children who have severe neonatal jaundice, that is when they become yellow or have the yellow eyes and yellow skin around the time of birth. The neonatal jaundice, when it's very severe, also predisposes or causes a number of them to have cerebral palsy. And some years ago, when we did a study at the Kolebu Teaching Hospital, we found that the neonatal jaundice was actually one of the main, or it was the major cause of cerebral palsy, which was preventable in the hospital. And that's why we've also done quite a lot of advocacy on it. If they have infections that affect the brain, they can also go ahead and develop cerebral palsy.
Well, so even if the last thing you mentioned is probably one of the things that one of the leading causes, and you also tell us that it looks like every week you are getting children with that condition, then it looks like we are not doing something right, isn't it? And what must we do?
What must we do? There is a number of the causes, or there are a number of causes that we may not be able to prevent. But from what I have said, there are also some that we can do something about, like the neonatal jaundice. We can do something about it. When you have your baby, you look out for jaundice in the baby or the yellowing of the eyes and the skin, and you report to hospital. When the baby becomes unwell, like has an infection, has a fever, it should be treated appropriately. Again, the pregnant women should go to hospital. Even before they become pregnant, they should ideally be receiving care in hospital. So the pre-pregnancy care is helpful. When they are pregnant, followed up in hospital, they should deliver in hospital, so that the care that they receive will help to prevent them from having babies who suffer from the asphyxia or the hypoxic ischemic encephalopathy that I mentioned earlier. So these are some of the things that we can do to prevent or reduce the incidence of the cerebral palsy. Again, our healthcare professionals are encouraged to be abreast of the literature and the information in care of the pregnant women, care of the woman during the delivery, care of the baby, helping babies breathe. When babies are born, within the first minute, they should be able to receive the first breath and cry. So all those are things that we need to try and do as health workers to support and prevent babies from suffering from cerebral palsy in the future. Now, when we talk about what we can do, aside these preventive things, when they come in and they have an infection, it's important that we treat it and treat it well to prevent them from developing meningitis or infection around the brain or other complications. And then if we in the hospital find or actually make the diagnosis of the cerebral palsy, it's important that we start the therapy or the supportive things that we can do to improve the life of the child early so that they do not get worse.
Interesting. I'm sure you saw how Martin is taking care of this child. How must children like his be catered for? How must they be handled?
Pardon me, how much?
How should children like that be taken care of? Is there a special way? How should they? Because Martin is doing it alone.
Okay, so children with cerebral palsy need a lot of love and they need a lot of care, and they are children first before the condition that they have. At the beginning, often we'll involve the clinical psychologist to help the parents or the caregivers to appreciate the condition that the child has, and also help them deal with the condition. Often, many parents feel guilty for the child becoming like that or having the condition. Meanwhile, it's often not their fault, and there was probably nothing they could have done to prevent it. So to help the whole family to settle in, we also will involve the care of the support of the others, like the speech therapist. Some of these children, or many of them, will actually have problems with their speech, and so the speech therapist will help with the speech. So they'll teach the parents what to do, how to help them with the communication.
All right.
Then we have the occupational therapist who will come in to support with the activities of daily living. You know, it's not even all of them who can walk. Many of them will have difficulties moving from one place to the other.
Okay, Doc.
So the occupational therapist will help to support with the activities of daily living. The physical therapist or the physiotherapist will also come in and help with the mobility or the physical, exercise, like moving the joints to prevent the joints from becoming stiff or from them getting contracted.
Okay.
The dietitian also very helpful because they will help to show them their diet. Some of them will have problems swallowing the solids, and so they will need to teach them what to give them to eat, the form it should be in, how to go about the feeding, because some of these children will also have swallowing problems even.
Okay, Doc.
The coughing, they may not be able to cough out if they have anything that is going down the airway. So we
I'm
try
grateful.
to get these involved to teach them and help them through their journey.
Okay, Doc, thank you very much. That's Dr. Hilda Boy. She is a pediatrician at the Kolebu Teaching Hospital. Hannah Awadzi, what should government do to support people like Martin? In the next 30 seconds.
The government to have centers where children can be kept safely while the family goes to work. Because these children are kept home, schools are not accepting them. Their parents are locked down, they can't work, and yet all the things that Dr. Hilda Boy said requires money. So how do you go for access health when you can't work? We don't have the centers, and our literature and our communication about these children have merely been very theoretical, not practical. They don't they don't see the day to day. I'm showing on the screen my daughter now, sitting at home, working on her computer. She can't walk. The thing is, even me, if I decide to follow through with all the therapies, I will break down as a mother. So something practical needs to be done. Every district assembly should have an inclusive center where a parent can safely leave the child. These therapies are done to them, and then they come back and pick their children. They go work, earn a living. Then the child does not become a burden on the family. The child does not become a burden on society. I have seen productive citizens who live with cerebral palsy because they got the right help. If only we could do that. Start small, get centers, inclusive centers in every school. I think it will be a very good start.
Thank you very much.
What government can do.
Hannah Awadzi is Executive Director for the Special Mothers Project.